we all agreed that we wanted to cover pre-existing conditions.
Well, let's talk about that. I was the insurance commissioner in California,
Yes.
91 to 95, 4 years, and then again in 2003 to 2008. And that 8-year period, I saw horrible things being done by the health insurance industry in the way in which they discriminated. There's one lesson that I learned during that 8-year, many lessons I learned, but one of the principal ones that for the private health insurance companies, it's profit before people. Do whatever you need to do to enhance your profits. And you just mentioned one of the ways, which is various mechanisms to discriminate, pre-existing conditions. I'll give you an example. I know of a young woman that had been on her family's program, health insurance program, for 23 years. She turned 23, and under the current law, a 23-year-old can no longer be on their parents' care. Under the proposal that will, under the bills that will be before us for final review, hopefully next week, is a proposal to extend that to 26 years. But for her, that wasn't yet law, and so she went out searching for insurance. Turns out she went back to the company that had insured her for 23 years. And the company said, "Oh, we can't insure you." She asked, "Why?" "You have a pre-existing condition." It turns out the condition was acne.
Yeah.
The list of conditions that would exclude you from coverage, called pre-existing conditions, is about 3 pages long for most insurance companies, which basically say, if you are a woman in the childbearing age group, you're not going to get covered. Why? Because you might actually have a child. My goodness, that's expensive. And we're not talking about family-friendly policies here, are we? But that's reality. For this young woman, she was excluded on the excuse of a pre-existing condition. Now, I happen to have been familiar with this woman, and I said, let me get on the computer and see what this is all about. So I entered her name. Came out, she was excluded. I went back and entered her name as a male, and she got coverage. Something seriously wrong, and the bills before us next week will eliminate that kind of discrimination, pre-existing conditions, as well as discrimination because you happen to be a woman. Those days will be over.
I'm so appreciative of your knowledge, and you live in an area that is a valley in Sacramento, California. And when I went up to Sacramento, and I spent 20 years there, and I inherited the health committee, as you've already mentioned, from you. I had it for 17 years. And I found out that I had allergies. And I spent years and years trying to find out why I had these allergies. And then I found that in this valley, the allergens collect. And I found out that I was allergic to grass, tree bark, cat hair, the CBCs, that material on the wall.
I'm sorry, Congresswoman, but you're uninsurable.
Well, exactly.
You cannot get a health care policy.
Exactly.
Unless you happen to live until you're 65. When you're 65, you will automatically be available for a single-payer universal health care program called Medicare. Yeah. People want to live long enough to get into that system, and at that White House meeting, most of the graybeards there were 65, and they belonged to that system.
Well, I finally made 65 and went beyond.
Oh, I don't believe it.
I did, way beyond.